Hi, my name is Stanley Charles. I am Surgical Technology Program student in CBD College, class Microbiology. I will be reporting on the turnover of OR after surgical patient with Ebola virus. Turnover of OR. At the end of each surgical procedure, the patient, if intubated, should be transported back to the ICU. Depending on the facility's practice, a non-vented patient may be transported to an isolation room in PACU, also known as post-anesthesia care unit. In order to limit potential number of healthcare workers, it may be important to transport the patient directly to ICU. Since most people on the surgical team may be sterile and unsterile, it is important to have a separate transport team waiting out of the PACU to transport patient to ICU. Teams should include ICU nurses and CRNAs. Teams should be in attire and CDC recommended PPE and must remain outside of procedure at all times. It has been suggested to have a tarp on the floor by the exit and sprayed with EPA registered hospital approved disinfectant. The transport stretcher should remain in the room to avoid the risk of unprotected staff. There should be no entry into or out of the patient's room. Once the patient has entered the room, staff needs to consider surgical instruments cannot be sterilized using sterilization methods. Sharp safety must continue to be a priority after a wound closure to prevent accidental injury to staff members. Linen and trash should be placed in sealed, leak-proof, and puncture-proof containers that are to be wiped down with approved disinfectant prior to be removed from the room. Suction canisters shall be sealed and leak-proof, puncture-proof containers to be discarded. Specimens must be handled according to facility's policy. No specimens obtained from a patient with EVD should be transported using a pneumatic tube system. Instruments must be free of blood and tissue. Instruments do not need to be soaked in sodium hypochlorite or sodium hydroxide. Instruments may be kept damp with sterile water. Instruments should not be sent to CSPD in a basin of water as this possesses a risk for contamination. Instrument and other items to be transported to the CSPD must be contained in an enclosed case cart that has been wiped down with hospital-approved disinfectant. As for the stretcher, cartwheels may be disinfected by rolling them over the tarp that has been sprayed with the disinfectants. The OR staff must personally deliver the case cart to the decontamination area to ensure that no one accidentally comes in contact with the cart or its contents. Cart cannot be left in holding area with other case carts waiting decontamination. Cart will be decontaminated by Central Steering Process Department. And then the last one's a video. Thank you so much for paying attention on the update for the turnover of OR in the case of having a patient with Ebola.